Today in Africa, we live in a global dilemma of health inequality and iniquity. This is worse when it comes to rural areas. 76.2% of Uganda's population lives in rural areas. That creates high demand for equitable health care services.
As one of the lecturers in the Department of Community Health, I've been involved with the community-based medical education since 1992. When Mbarara University of Science and Technology started, one of the major components that was expected was that it would train doctors who are very responsive to our community challenges. And one of the components that was introduced in the curriculum was to expose the health professional or education students, and at that time medical students, to community-based medical education, where students spend some period in the communities trying to understand communities' problems and devising ways of overcoming them.
We annually send students to communities, about 54 sites. And annually we send these students to participate in health promotion activities. They also participate in offering services at facilities where they are, because these are health professional students.
This was during the time of Professor Kayanja as the founding Vice Chancellor of Mbarara University of Science and Technology, who spearheaded this program. At that time it was known as community-based education. After 2000, community-based education was expanded to include some element of research, and it changed the name to become COBAS, Community-Based Education, Research and Service. This initiative of COBAS has also been championed by the current Vice Chancellor, Professor Celestine Obua, who through his efforts we have been enabled to have the First Mile project, which is continuing the work and expanding the work of COBAS.
It came in to fill in the gap. And on this note, I can't forget to thank our leaders, the leadership of the program, who not only did they have the vision, the big vision, but they also made it, actualized it. And under their support, students have been going to these communities and further be supported with some funding to be able to implement their projects.
An extension of the community placement, which happens usually every year by Mbarara University of Science and Technology for the trainees who are for the undergraduate trainees. So initially they were coming for only 4 weeks, 3 to 4 weeks. But when the First Mile program came in, the time of their stay in the community, that is because they are based here at Rubaya Health Center 4, the time was extended in the program, and that was very beneficial because the 4 weeks initially were not enough to finish their projects, what they are working on. So when the time was extended, they got enough time to actually do implementation, re-implementation and monitoring, because initially they were spending the 4 weeks in planning, and as they start to implement, then they have to go back. But now at least they have time to implement, and obviously if they implement, the community benefits, and if the community benefits, it means that the disease burden will reduce, and then finally us as a facility we shall also benefit.
Our project from the start, it was to promote, to improve the proper hand washing and sanitation from 30% to about 80% by the time we're done with our placement. So we started by intensive health education. We had outreaches in the communities. We went to churches. We had community gatherings. We had education at the OPD, Outpatient Department of Bugaya Center 3. And we also bought some few things to help set up easy hand washing facilities in the communities.
They have had amazing projects in the community. In Chivito Health Center 4, located in Bunyangavu district, undergraduate students conducted a project on non-communicable diseases, diabetes and hypertension. You can't believe, but undergraduate students started a clinic of diabetes and hypertension in Chivito Health Center 4. It runs on every Thursday. From the little money that they got, they were able to buy the equipment for the clinic to start with. They bought blood pressure machines, they bought glucometers, they bought height meters, they bought glucose strips. This has provided a good start for this clinic, and the community is happy that they are able to access the care that they would otherwise travel miles to access.
This community-based education program has not only attracted our local students, but has also been opened up to international students. And we have had a number of universities participate in this, starting from Harvard University, where they send 2 of their students annually through MGH. We have also had universities from Lund in Sweden also sending their students. We have had Saskatchewan in Canada send their students. And of recent also the University of Michigan has also joined in send their students. This has attracted an international platform where we're able to participate in global health and training and teaching.
Mbarara University of Science and Technology, one of the best and most prestigious universities in Africa, was blessed with a generous and supportive partner. And this is none other than the Center for Global Health at Massachusetts General Hospital in the United States of America.
When I was coming to Mbarara University as the Vice Chancellor, one of the things that I was told to do by the then Chancellor, Professor Peter Mujenyi, was to support community attachment program, which has made this university proud of the products that come from Mbarara University. The COBAS, the Community Outreach Program, that we conduct, placing undergraduate students into the community so that part of their learning takes place in the community. And to date, we have 4 main sub-programs in what is now being referred to as the First Mile project. These 4 main sub-programs include the support that we give to the nursing department in their outreach program called the Ubuntu Project, where they use primary school children in trying to reach to the community and educate the community in various health aspects. The second program is support to Mbarara Regional Referral Hospital, where we are employing nurses for the hospital, including training the nurses in the hospital. The training component, which is actually the largest second component, is run by the Faculty of Medicine, headed by the Dean, Faculty of Medicine, which includes supporting, giving fellowships for people to train in the critical care nursing program. And then overall micro-research money, which is given to all the faculty in the university to participate in research, small research projects, which I think is about $5,000 that are given for them to conduct micro-research. The third component is the innovation component under CAMTech. This is very important for us as a university because it combines students and their mentors, lecturers, to carry out innovative research projects. The fourth and perhaps the largest component is the community outreach that is under the community, the community health program. The community outreach is support that we give to our partners who support us in the community placement when we send our students for the COBOS program. And I'm told now that this program has expanded by not only placing undergraduates into the community health facilities, but it now also includes the placement of postgraduate students, for them also to experience some component of community health training.
The approach used in Priority Area 1 essentially was a bidirectional approach, where we had health workers working out in primary care facilities in the community coming to MUST, and MUST going to the communities. Now, the various components under the Priority Area 1 consist of the following: a community health focused hackathon that was run in August of 2018, close to the launch of the program. This one essentially consisted of bringing together different stakeholders who are working within communities in developing innovative solutions to public health challenges. The second component under Priority Area 1 consists of supporting postgraduates to rotate within primary health care facilities in close to 16 districts in the southwestern region, a coverage of about 44 health facilities. The third component under Priority Area 1 was support to faculty to mentor healthcare providers within primary care facilities within the southwestern region. Another component that was very critical is one where research support was provided to both faculty and postgraduate students within MUST. We should remember that due to funding constraints, research funds are not really readily available for faculty and postgraduate students to undertake research. So this support was very timely during the whole period of the program. Another component consisted of supporting the first annual Community Health Conference. This conference actually brought together a number of stakeholders we work with, MUST works with, within the communities to disseminate the kind of work that we have been doing over the years.
The major goal of the program was to make MUST a teaching and training hub for community-based healthcare providers at low health centers in 19 districts of southwestern Uganda. This is just the first mile. Join me for a tour and see the great achievements the program has had on the different communities. You may end up donating yourself.
We focused on the community health program for simply two reasons. One, MUST has championed a community model of medical education for years, and this model has shown to be very good in two ways. One, increasing service delivery at the lowest level possible of care, and two, having good quality of care, making sure that the next generation of health workers are grounded in what is priority in the communities around them. Those components are very important to have a very excellent doctor, excellent nurse, excellent pharmacist, somebody who is attuned to reach or meet the needs of the patient of tomorrow.
With the first mile, we've been able to send our students to reactivate this program at postgraduate level. We sent our students to two health facilities in particular, but as a mentor before that, we had to make visits to these health centers, identify the health challenges, and then have a pre-placement training for our students and just tell them what our expectations are. So we sent two of our graduate students to Lyantonde And then we also sent one to Rukunyu Health Center. So while there, they spent there 2 weeks. They were able to interact with the community. They were able to appreciate the health challenges at different health facilities outside of a regional referral hospital. And they identified major issues like lack of oxygen, lack of proper monitoring of patients, a poor referral system, and that could help them to realize why some of the patients that we receive as referrals from these health facilities look like what they look like. Like if a patient comes in very sick, then you can understand that it's either a very poor referral, a late presentation of a patient, or really lack of basic stuff at the health facility where they've come from. So while there, the students were able to participate in getting involved in some of these, and they were able to try and help the local clinicians at those units. I'll give an example of Rukunyu. So Rukunyu is a very beautiful health facility with good infrastructure, equipment, but we found that their medical ward had an ECG machine and an ultrasound machine that were packed, brand new, but they were not being used. Why? One, they lacked the skilled human resource, so they have medical officers, but they couldn't really appreciate how to use this equipment. And luckily, one of our postgraduate student who was placed at Rukunyu has both skills, so he can ably perform an ECG and interpret it, and then he also has very good ultrasound skills. So during his 2 weeks placement, he conducted quite a number of CMEs where he was able to impart the knowledge and the skills to these, the healthcare workers in that facility. So he was able to have ECG sessions with the doctors and also ultrasound sessions with the doctors themselves, but also with the nurses. But because we realized that a follow-up visit, like yes, we might teach them how to do ultrasound scans, but you can't really learn in 2 weeks. So we also were able to set up and give them our numbers and say in case they have challenges, someone can do an ECG. They may not be confident to interpret it, but they should be able to send us an image, and very quickly we can send them an interpretation of that ECG. So personally, I was involved. We ran clinics there, we did the ECG training, and by the time we left, we were confident that at least these people were close to 85–90% confident to be able to use this equipment should the need arise.
I work as a consultant ophthalmologist at Mbarara University of Science and Technology. We were privileged to collaborate with the First Mile project, and we provided mentorship opportunities for our residents to be placed in the rural communities and work at the primary health facilities in several parts of southwestern Uganda. Most of our residents come from different parts of Uganda, but also some have international experience. And this was a very good opportunity for them to interact with the community and see firsthand what the local problems were. At these primary health facilities, most of our residents were quite amazed at the challenge and the burden of eye care in the community, with several people not being able to access the care they needed. In this placement, we provided opportunity for our residents who then stayed for a few weeks at those primary health facilities. They were able to start several innovations to provide eye care to the people. For example, in several primary health facilities, we started, for the first time, we started eye clinics, which provided screening and treatment services for the rural people to access.
We mainly take our residents who are in second year to the community in various places in southwestern Uganda. We have taken them to Kabale, to Kasese in Bugoye, to Yantonde in Rengo, and Rushere Hospital, and a few other places, plus Rekubo in Isingiro. These are the places where we see lots of challenges in obstetric care and maternal child health. Those are places where access to quality maternal child health services are really very difficult. So our residents go there and spend a month. During this time, they go to these health facilities and take the expert obstetric health care closer to these communities in that 1 month. They do operations at the community. They help facilitate these health facilities. Some of them had never had a C-section in their lifetime. But when we took down these residents down there, those are our students, they help these health facilities start operating on the mothers who had complications or who needed cesarean sections, which had never happened before. So this has helped the community really reduce on the complications and the delays which they really have in order to access quality obstetric care. Not only do they do operations and also see patients, no, they also helped train the healthcare providers, those are the midwives at those community health facilities, in emergency obstetric care and other challenges in obstetrics and gynecology. So it has really helped the students and also helped the community.
It gave me a first-hand opportunities to see in real time what they go through in making decisions concerning obstetric emergencies. But it also gave me an opportunity to share a few of the experiences and work collaboratively with the teams at the other facilities to come up with a tool for pregnancy hypertension, because within the first week we are able to identify and do the community diagnosis, and noted that pregnancy hypertension was one of the obstetric emergencies that was causing maternal death and neonatal mortality at that unit. And we are able to come up with a tool to quickly guide through a treatment tool, sort of a algorithm, to guide the clinicians and nurses at the facility to be able to handle these mothers in time and then make referrals without any delays. So this program, in addition to giving me that rich experience, has been able to mentor me into conducting, being able to conduct out of referral care and learn what these rural or peripheral units go through on a day-to-day basis when they are providing care. But also the experiences gotten there, sort of as an individual, I now judge-less the providers at those units, knowing the critical challenges that they face to be able to provide emergency obstetric care to these mothers.
They pass on skills and knowledge to all of us, all the different categories. They conduct CMEs, we do see patients with them, we do operate patients with them.
A team of medical laboratory science postgraduate trainees that went to Kabyanda left an amazing input. Patients would be referred to as far as Mbarara only to access blood transfusion. Some of them would not make it. But with the students' 2 weeks stay at Kabyanda Health Center 4, they were able to start emergency blood transfusion at the facility. As we talk now, for more than 1.5 years, patients in Kabyanda are able to access blood transfusion at the facility.
As the in charge of Hamgwai Center 4, I've benefited from the First Mile Health Community Health Program in a number of ways. Number one, I have benefited from several CMEs. For example, the one on leadership and one on ETAT, which is most recent, where we gained a number of skills in emergency triage, assessment and treatment, of children, and this has definitely built my skills when it comes to management of children in this health facility. We were trained by a number of experts who were led by Dr. Kumba Kumba Elias, and that has been helpful to me, and I've used the same skills to train my health workers here who are also helping in treating children. So it has definitely been important. Number two, we were in a conference where we presented a number of papers. Personally, I was one of the people who had prepared a paper, and I presented on male involvement in maternal and child health programs. And I definitely listened to a number of other experts, other researchers, and that has definitely built my skills in the day-to-day running of my activities. So definitely this program has been important in my career, and just important to note that I started my bachelor's from Mbarara University of Science and Technology. I was there from 2009 to 2014, and in 2013 I was part of the students who were deployed under COBAS in Uganda, and I benefited a lot, and this has helped me to serve in a community setting like this.
It brought us closer to Mbarara University of Science and Technology Teaching Hospital, whereby it has now become our referral point. We have been in touch with those students, and they taught us a lot of things here. They did some skin grafting, a lot of major surgeries here, because I had theater had equipment but didn't know what to do with them. So there's that connection which we have developed. We got the ophthalmologist. As you move around the compound, you even see they established a clinic. They did some community programs, the community outreaches. They trained our staff. We had the ophthalmology clinic officer who was actually employed here but not working as an ophthalmologist. So we established a clinic. It is there working now. Yeah, he's having weekly clinics, which are actually running concurrently with the diabetic clinic. We go to lab students, and I think that one they also had some, because our lab has now improved. I think the quality improved after that, because there was a lot of mentorship. These people. Then of recent, when we got the ophthalmologist again, we started outreaches, and that's one of the biggest components we are missing up in our plan. Treating, but we're not having outreaches. So those ones started, yeah, and we have been having some radio talk shows concerning the same.
With this partnership, the First Mile Community Health Program was developed to support MUST's community engagement and mandate.
We receive these postgraduate students from MUST, especially from the Department of Obstetric and Gynecology. And when they are here, they teach us a lot. They give us CMEs, that is continuous medical education, and mentorships on job. For example, we had some time back Dr. Okello and Dr. Johnson Bahat. They taught us so many things. For example, doing manual vacuum aspiration. This is a procedure that we do to help mothers who got abortions in the first trimester before 8 weeks. It helps them in a way that they will not need to be referred to a higher facility. They will find the services near them, and it is comfortable in a way that it doesn't need a lot of skills. It doesn't need a highly skilled personnel to the extent that a midwife can do it. Secondly, they mentored us on doing cancer screening, and we can now comfortably carry out cancer screening to all women who deserve. Secondly, when these postgraduate students are here, for example, we had a surgeon, he was called Dr. Mhanji Bosco. The community enjoyed him so much in a way that he carried out so many minor surgeries, and many people didn't know that their cases could be diagnosable and manageable. So those that were, of course, managed at this level, they were managed, and those he couldn't handle because of the capacity of the facility, he referred them and they found care in higher facilities.
Working here as a medical officer has given me opportunity to interact with undergraduate and postgraduate students from Mbarara University of Science and Technology under the project of First Mile Community Health Program. I interacted with a number of them, especially those who I can remember very well, like Dr. Elijah Rutahaba, who came here as a student specialist in internal medicine, and also Dr. Mai Saba, who was a specialist for treating diseases in women and also in pregnancy. Then I also interacted with Dr. Geoffrey, who came in as a specialist for treating diseases of the eye, and Dr. Kamau, who came in and treated diseases that involve surgery or operation. As a medical officer, I have had a number of benefits on my own as a person. Like, I've got opportunity to learn new things and also practice under the guidance of more qualified medical workers in the name of specialists. On the side of the patients, they have benefited a lot because formerly the conditions or diseases that we would not treat because it would require more skills than what we could offer. They had to be helped by the specialists who could treat them in a way more appropriate than we do. And not only that one, we were able to make referrals to the hospitals where they come from, that is Mbarara Regional Referral Hospital that acts as a teaching hospital for Mbarara University of Science and Technology. And we had a direct link so that when we would refer patients from here, we would call someone from there who would enable the patients to be attended to very well. Working with Dr. Kamau, who was a postgraduate student in surgery or someone who would operate people, has inspired me to also think of taking a path towards becoming a surgeon, and I look forward into one day joining the university again to do Master of Medicine in surgery.
Through this program, I learned many things, including managing normal labor, resuscitation of the newborn, antepartum hemorrhage, postpartum hemorrhage, management of hypertensive disorders during pregnancy and in labor, obstructed labor, to mention but a few. I'm going now to focus on resuscitation of the newborn, of which I got more knowledge and skills. Through this resuscitation of the newborn, I've been able to save many lives, of which these babies are born when they are asphyxiated, when they are tired, and it has helped save many lives.
It was the First Mile program under Mbarara University, where I was chosen to present the Mbarara Health Center facility, and I took 3 days training. In so doing, I learned about infection control, and when I came here, I practiced what I had got from the training. And as you can see, we have a hand washing facility. Shortly after I came from the training, immediately I sensitized the staff on infection control and prevention. Then when like 1 month after, the COVID-19 started, and since we had already trained on infection prevention and control, it was easy for us to train the community, and the community has benefited a lot because of the knowledge we got from the training.
There has been great change in some of the services we offer here. For example, one of the midwives, when they were trained about IMCI, she came and she taught us a lot of things. For example, admission forms for the neonates, organizing special cupboards for the medicines for the children. Those we knew, but we had not yet implemented them. And when she came, we were able to understand doses, we were able to understand how to organize the medicines and how to manage children who are very, very sickly in an organized manner. Yeah, so we really thank the First Mile program for the quarterly CMEs.
The community has gained because the team has been treating our patients who have been suffering from different diseases, which diseases most of the staff we have here may not treat them very well, but because Mbarara is more advanced than Rukunyi Hospital, so the staff there are more knowledgeable and experienced, so they have assisted us in this community services.
Some of the challenges may be a bit beyond our control, but we were able to identify that in some of these health facilities, they just lack very basic equipment, so it makes the management of their patients difficult. They do not have oxygen monitoring probes, they do not have blood glucose testing machines. Some of them didn't even have like a working blood pressure cuff. So these are small things which can lessen the burden of the patient load at the regional referral center if the lower health facilities have done what they're supposed to do appropriately. So I don't know if the funding can extend to procurement of very basic equipment that these health facilities can at least have and take care of, and then keep in touch with somebody at the regional center.
We would have wanted this program to be continuous, in that we do not stop taking them. When we take one student for a month, then another student goes for another month, such that there is no breaking. Right now it's only for 1 month, then until the next year. So we would want it to be all year round, such that there is no break in this program.
So given further opportunity with the First Mile and funds being available, what we would like to see is a more comprehensive approach at the primary health facilities, where we provide both medical treatment but also surgical care in form of surgical camps to provide cataract service and glaucoma service and solve the problem of needless blindness in our communities.
My wish as a midwife at River Center 4 is to see these postgraduates staying with us longer than they do, because we need them for the services they render to us as a River community.
Of course, had the challenge of accommodating them. We have a lot of land here. We had requested First Mile to create some environment like I've done in other facilities, like in Kasese, in Rubirizi. We said they can put up some structure for the First Mile students. So when they are around, from Mbarara University Science and Technology students who come around, they can always have accommodation, conference room. I think it can be possible. We live in a village settings, and accommodation is not an easy thing.
Our prayer is that First Mile Community Health Program stays longer in Kamwenge at Rukunyi Hospital, because we have a lot of challenges, a lot of sicknesses. We have very many people, a bigger community to be served at this hospital.
I am very proud of this program. This is one of the programs that has grown beyond the wildest dreams that I have ever had, or my partners with whom we wrote this program had at that time. The support that we get from the Mass General Hospital in this program is immense. They help to mentor the faculty that we are working with. They also help us to renegotiate this program with the funder. The funder of this program is the Wyss Medical Foundation, based in the United States of America. And these people are great, great philanthropists. We couldn't have landed a better funder than the Wyss Medical Foundation. Initially, we had asked for quite a small amount of money. I think what we had asked for was less than $3 million. The Wyss Medical Foundation has given us, or has granted us, a total of $11.8 million. We have received the first bunch of funding. 2 years has ended, and we are going to go into the second phase. We have submitted a report, and our prayer is that this funding is going to continue. It is growing day by day. The impact that the First Mile has to the greater Mbarara community is more than anybody can envision. I think that of all the projects that is being run at Mbarara University, nobody can undermine the level of support that we get through the First Mile. We are grateful to the funder. I am grateful to my colleagues who are heading the sub-programs. Dr. Grace Nambozi of the Nursing Department, Associate Professor Gertrude Kiwanuka, who is the Dean, Faculty of Medicine, heads the training component and the support to the hospital. Associate Professor Edgar Mulogo heads the community health program. And I think he has the largest cake in the program, but he doesn't eat it alone. He's very good at distributing it. I'm proud of the way he has handled the program to date. And I think through his hard work, this program is going to have a far-reaching impact, not only to the university and not only to Mbarara region, but to the country as a whole.
The program would not have been possible without the vision and stewardship of Professor Bua, the Vice Chancellor of MUST. We also appreciate the oversight provided from MGH through Dr. Louise Ivers, the Executive Director of the Center for Global Health at MGH, Dr. Geren and his team at MGH. Further, we also acknowledge the support that has come from the Dean Faculty of Medicine. In a special way, we would like to thank the Global Health Collaborative MUST, led by Dr. Simwe, for the coordination efforts in ensuring that we have accomplished all within the 2 priority areas.
I really want to thank the Department of Community Health of Mbarara University of Science and Technology, where this program of First Mile is based. It has really been very good to the department. We're the first department in this university to be initiated or to be helped with the community program for our residents. Also want to thank the Dean of Medical School, that's Professor Gertrude and Dr. Ngonzi, who helped us in getting this program down to our department. And also want to thank the communities and the health facilities where we take our students. They have been very good and receptive to our students. They have given them good accommodation, which they don't complain about, and they have received them very, very well. I also want to thank my fellow members of the Department of Obstetrics and Gynecology at MUST, and also the mentors in this department who go down and to supervise these students when they are down in the community. They have really been very, very, very good. And also want to thank the funders of First Mile, this program. They have for helping us with the funds and all the necessary help in this project. So thank you so much.
As Faculty of Medicine and as the Dean Faculty of Medicine, I have been overseeing 3 different subcontracts as the core PI. And these subcontracts, 2 of them have been very helpful in providing scholarships to our students, for which we are very, very, very grateful. We've partnered with MGH for quite some time, but for the past 2 years, it has been terrific because it has enabled us to offer scholarships to quite a number of students, postgraduate students, on the Master of Medicine program in different disciplines, but also the Master of Nursing Science in Critical Care Nursing from First Mile program we were able to extend scholarships to 31 Master of Medicine students. And then in 2019-2020, we still extended 8 MED scholarships, but this time around, we focused on those departments that struggle to receive postgraduate students. And these are the specialized departments. We focused on the departments of psychiatry, ENT, radiology, dermatology, ophthalmology, and pathology. All in all, if we are to total up the students who have benefited from this program, we have over 80 scholarships from the WIS Foundation. So what does this mean to the Faculty of Medicine? It means that this First Mile program has enabled us to achieve part of our dream in offering quality training to our students at the high level who actually struggle to get support for their training. So when you have a partner, when you have a friend who comes in to join hands and to support students to achieve their dream, and not a dream which is going to end with themselves, but a dream which is going to reach thousands, if not millions of Ugandans, but also of individuals beyond the borders of Uganda. We are proud. And to say thank you, I think thank you, if I had an opportunity to write 1,000 thank yous, perhaps I'll do that. So thank you is not just enough. But I just want, on the behalf of the faculty, on the behalf of these so many students, I just want to say thank you. Thank you, thank you, thank you to the WIS Foundation and also to the MAST Global Health Collaborative for extending that kind of support which has facilitated the training of our students.
Following the COVID-19 outbreak, MGH, in partnership with MAST, agreed to support the COVID response spearheaded by Mbarara Regional Referral Hospital to tackle the pandemic in southwestern Uganda. Through the First Mile program, the following was provided to support emergency preparation towards the pandemic. This included construction of the COVID-19 treatment center, or one would call it the isolation ward. The site plan was approved by the Building Health International. The program has also supported and facilitated all frontliners in all categories for 3 months. They've gone ahead and procured personal protective equipment, to mention but a few. While launching a related program, Professor Gertrude Chiwanuka, the Dean, Faculty of Medicine, said, "If MAST is to end, this will be in the community." I could not agree with her more. MAST's passion for the community has resulted in the strengthening of health service delivery. Through this, they are able to achieve the Astana Declaration 2018 on primary health care. Thank you all. Special thanks go to our partners. I've been your narrator, Angela Nakato, from the Communication Department, Mbarara University of Science and Technology. Succeed, we must.